Hello, my name is Dr. Asma Zafar and our today's topic is bad breath or fetor oris, which is also known as oral malodor. So after watching today's video, you will know all the basics about what is halitosis, how can we diagnose halitosis, what are the causes of it, and how can we prevent halitosis. So bad breath is caused as a result of highly volatile and complex substances. So these volatile molecules include sulfur compounds, aromatic compounds, nitrogen containing compounds, amines, short chain fatty acids, alcohols or phenyl compounds, aliphatic compounds, and ketones. The main compounds here are hydrogen sulfide and methyl mercaptan. They produce bacteria by enzymatic reactions of sulfur-containing amino acids. By having poor oral hygiene, the bacterial plaque and the food debris will accumulate on the teeth and the oral surfaces. All of this would lead to the formation of dental caries and periodontal diseases like gingivitis and periodontitis. So the inflammation of gingival and periodontal tissues in turn increases the chances of halitosis and the severity of halitosis as well by increasing the sources of malodor. However, the saliva in the oral cavity helps to keep the oral bacteria at manageable levels, and that is the reason why a decrease in oral saliva can lead to increased chances of halitosis. Now the question is, how can I know if I have bad breath? The most common and easiest one is your friends and family who would tell you if you have a bad breath, and that generally makes people less social. The assessment of halitosis can also be done in the clinics by organoleptic measurement, gas chromatography, sulfide monitoring, chemical sensors, BANA test, quantifying beta-galactosidase activity, salivary incubation test, ammonia monitoring, and ninhydrin method. Now, bad breath is very common in both the genders and in all the age groups. It is in fact so common that almost 50% of the population has bad breath. It is very important to notice here that 90% of the causes of bad breath are oral related. They are related to the mouth, while the rest of the 9% are related to non-oral reasons. While the remaining 1% of the population suffer from bad breath as a result of drugs or diet. Now the question is, why is it important to get rid of it? The answer is very easy. So it creates social and psychological disadvantages for individuals, and it also negatively affects the relationship of people. And now the very important last question is, how can we get rid of it? Now the bad breath can be managed by using self-care products or by professional treatment. The self-care products may include the use of chewing gums, mints, mouth rinses, toothpaste, and also avoiding the foods with strong odors. And now comes the professional treatment. The professional treatment of halitosis includes the identification and management of the cause of the bad breath. So the professional treatment also includes the management of periodontal tissues, scaling, root planing, using chlorhexidine as an antiseptic agent. And last but not the least, it is very important for the dentist to give proper oral hygiene instructions to their patients. Those instructions can include proper brushing, flossing, use of interdental brushes, how they can use mouth rinses, and also how to clean the intraoral devices. Another very important point to note here is patients should know that they need to clean the dorsum of their tongues in order to keep the bacterial count low. I really hope you found this topic very interesting. See you another time.